If you're over 60, what changed this February could directly affect your Social Security income and Medicare coverage. In a single legislative cycle, Washington approved adjustments that impact over 68 million Americans, from monthly benefit amounts to prescription coverage costs. And many seniors still don't realize how these changes could affect their household budget this year. In this video, I'll break down exactly what changed, who is affected, and what you should do next. For months now, there had been signals, not official press releases, not formal congressional testimony, just signals, that the Social Security Administration was preparing something significant. The SSA has been methodical, yes, but they have been deliberate in their methodology. Their adjustments have followed a certain rhythm, a pattern, almost a predictable annual formula. But what set off alarm bells in senior advocacy circles this February was that the usual rhythm went silent. Experts who monitor federal benefit adjustments know the indicators, the cost of living adjustment announcements that typically generate clear guidance by late autumn, the Medicare premium notices mailed to beneficiaries before the new year, the Part D plan adjustment windows that open and close with clockwork regularity, the sudden freeze in plain language communication from CMS, the Centers for Medicare and Medicaid Services. All of that went unusually quiet heading into 2026. And whenever Washington goes quiet on senior benefit policy, it means something is about to get very loud and very real for the people depending on those benefits to survive. Early this February, benefit analysts detected what they described as a compounding adjustment scenario, including simultaneous changes to Social Security payment formulas, Medicare Part B premiums, and Part D out-of-pocket caps that had not been restructured in this particular combination in over a decade. These are the kinds of adjustments that the federal government only implements when they are signaling something very specific: a response to inflation data, a structural shift in program financing, or a redistribution of cost burden between the government and beneficiaries. Policy observers didn't know which category this fell into, or whether it fell into all three at once. But what they did know was that the SSA and CMS were changing their posture simultaneously. And when two massive federal agencies shift strategy at the same time without clear public communication, every senior in America needs to pay attention. The alert issued by senior advocacy organizations this month was not normal. It was not routine. It was not symbolic. It was urgent. Briefing after briefing described the February 2026 changes as layered, interconnected, and perhaps most importantly, financially consequential in ways that won't be immediately obvious on your first benefit statement. But confusion only wins if the beneficiary hesitates. Prepared seniors did not. In fact, the response from informed advocacy communities this month has been among the most organized we have seen in years. Here is what we know. Within weeks of the changes taking effect, benefits counselors began fielding record numbers of calls. These weren't routine questions. These were urgent, specific inquiries from seniors who had opened their mail, seen numbers that didn't match their expectations, and needed answers immediately. Tonight, confirmed federal data shows that the Social Security Administration implemented a 2.5% cost of living adjustment, the COLA, for 2026. This is the adjustment that took effect with January payments, meaning most of you have already seen it. But here is what many seniors missed. While the COLA increased your gross benefit by 2.5%, Medicare Part B premiums also increased. And for millions of Americans, that premium is deducted directly from your Social Security check. The standard Medicare Part B premium rose to $185 per month in 2026, up from $174.70 in 2025. That is an increase of over $10 per month, or roughly $124 per year coming out of your check. They adjusted the COLA, they raised Part B premiums, they restructured the Part D out-of-pocket cap in ways that affect seniors on high-cost medications. In other words, what was given with one hand was partially taken back with the other. The component that determines your actual take-home benefit, the net amount after Medicare deductions, is the number that matters. This is what made the advocacy warnings so urgent. The headline COLA number looked like good news, but the full picture required a much closer look, and seniors who didn't look closely enough were left with less than they expected. And here is where this story becomes even more important. Policy analysts now believe that the February 2026 adjustment structure was designed to test the financial resilience of fixed-income seniors after years of elevated inflation. The federal government wanted to see whether benefit structures could absorb cost increases without triggering widespread political backlash. But something unexpected happened. Seniors and their advocates didn't simply absorb it. They pushed back with information, with calls to congressional offices, with demands for clarity, and that response was so coordinated, so informed that even federal agencies noticed. You don't get Washington's attention easily, but this February, organized seniors did. Benefits analysts speaking with national media under anonymity described the adjustment structure as a soft means test, a quiet way to redistribute program costs toward beneficiaries without calling it a cut. But informed seniors proved that they remain both watchful and vocal. Their response was not only immediate, it was targeted so precisely that specific provisions are now under congressional review. That matters because it shows something important. It shows that seniors are not passive recipients of whatever Washington decides. They are active participants in a system that depends on their engagement. As reports continued coming in throughout February, we learned more about the full scale of what changed. Medicare Advantage plans carried out significant network and formulary changes effective January 1st, forcing millions of seniors to verify whether their doctors and medications were still covered under their existing plan. Part D prescription drug plans targeting seniors on brand name medications saw out-of-pocket costs shift under the new $2,000 annual cap, which is genuinely good news for high-cost drug users but requires active verification. Supplemental security income recipients operating on the lowest fixed incomes reportedly faced the sharpest net impact when housing and utility costs are factored against their adjusted benefit. This wasn't just a paperwork update. This wasn't just a minor annual tweak. This was a structural realignment of how costs flow between the government, insurance intermediaries, and individual seniors. And structural realignment is the one thing that catches fixed-income households most off guard when communication fails. Remember, many seniors thought the $2,000 Part D cap would automatically reduce their drug costs without any action required on their part. They thought their Medicare Advantage plan from last year would carry forward with the same network and formulary. They thought the COLA increase would show up in full as additional money in their pocket. But tonight, the reality looks different for many households. Premiums consumed a significant portion of the COLA increase. Plan formularies changed, requiring medication reviews. And some beneficiaries discovered midstream that their preferred pharmacy or specialist was no longer in-network. What makes this moment so significant and so urgent is that these changes arrived at a time when millions of American seniors are already under profound financial pressure. Those on fixed incomes want their purchasing power protected. Those managing chronic conditions want medication continuity. Those newly eligible for Medicare want clear guidance before making enrollment decisions they cannot easily reverse. And working seniors approaching 65 want to understand exactly when and how to enroll without penalty. Washington is balancing these demands while navigating a politically charged debate about the long-term solvency of both Social Security and Medicare. And when federal agencies in that position make simultaneous adjustments across multiple programs, they are not doing it casually. They are doing it under pressure, budget pressure, political pressure, and the actuarial pressure of an aging population. The CMS guidance, now distributed through Medicare's official channels and the Medicare.gov website, was designed to signal that the federal government is not willing to allow benefit confusion to go unaddressed. Officials noted plainly that the combination of COLA adjustments, premium increases, and Part D restructuring was intended to improve long-term program sustainability. That is careful bureaucratic language for costs are shifting and beneficiaries need to read their mail very carefully. You don't usually see that level of simultaneous change from federal benefit agencies unless something significant is being restructured at the foundation. Meanwhile, senior advocacy leaders addressed their members in direct, urgent communications this month. They said, "Do not assume your coverage from last year automatically reflects your best option today." They said, The $2,000 Part D cap is real, but you must verify your plan still covers your specific medications at your preferred pharmacy. And they said, if your net Social Security payment surprised you this January, call your local SHIP counselor, State Health Insurance Assistance Program, immediately because free help is available. These are not empty reassurances. These are statements from organizations that understand exactly what is at stake for the 68 million Americans who depend on these programs as their primary financial foundation. Here is what makes the situation even more consequential. The February changes were not isolated to Social Security and Medicare alone. Along with the primary benefit adjustments, Medicaid eligibility thresholds also shifted in several states, affecting low-income seniors who rely on both programs simultaneously. Supplemental Nutrition Assistance Program, SNAP, benefit levels for senior households were recalibrated in ways that intersect with the Social Security COLA. And Medicare savings programs, which help low-income seniors pay their premiums, saw their income and asset limits updated, which means some seniors who previously didn't qualify may now be eligible for help they didn't know existed. All of this happened within the same benefit cycle. When multiple federal programs adjust simultaneously, it means something larger is underway, and that every senior household needs a comprehensive review, not just a quick glance at one statement. Policy analysts are now considering several possibilities for what comes next. One is that Congress is preparing additional Social Security reform legislation targeting the program's projected 2033 funding shortfall. Another is that CMS is attempting to slow Medicare cost growth by accelerating the shift toward Medicare Advantage plans, which now cover more than half of all Medicare beneficiaries. A third possibility, the one concerning senior advocates most, is that future COLAs may be calculated using a different inflation index, one that some economists argue understates the actual cost increases experienced by older Americans. But today, informed seniors took that uncertainty off the table for themselves. They didn't wait for the news to come to them. They didn't assume last year's plan was still optimal. They didn't ignore the paperwork. They took action, reviewing their coverage, calling their counselors, and making informed decisions before deadlines passed. What we are watching now is a test of engagement. Washington wants to see whether seniors will passively accept structural shifts without demanding clarity. Informed seniors want to show that they will verify every number, question every change, and use every resource available to protect their benefits. Advocacy organizations want to prevent a quiet erosion of purchasing power that doesn't make headlines but devastates individual households. And Congress wants to prevent a political reckoning that follows when millions of seniors realize mid-year that something changed and nobody told them plainly. Tonight, we have heard from SHIP counselors, your free, unbiased Medicare help resource, who are now fielding record inquiry volumes. They say call volumes are running significantly above seasonal norms. They say the most common question is why the net Social Security payment didn't increase as much as the 2.5% COLA suggested it would. And they say the decision by CMS to implement premium increases and benefit adjustments in the same cycle is likely part of a broader cost management strategy intended to slow federal program expenditure growth without triggering visible benefit cuts. But organized seniors are not sitting quietly. In fact, seniors who have engaged with counselors, reviewed their annual notice of change, and taken action during the Medicare plan review window have already positioned themselves significantly better than those who have not. Their response this season, informed, active, and coordinated, sent a message to federal agencies that seniors are watching every line of every statement. And it sent a message to Congress that this constituency will not be managed through silence and complexity. As February moves forward, we expect more details to emerge about what exactly these combined adjustments mean for your specific situation. But what we do know is that the advocacy response was timely. It caught issues before they became irreversible. It connected seniors with free resources before plan change windows closed, and it transformed a confusing policy moment into an opportunity for seniors to take genuine control of their financial and medical coverage. What happens next will depend on what Congress does in the next budget cycle. If they move to stabilize the COLA calculation methodology, this moment will be remembered as the turning point where senior voices reshaped federal policy. If they proceed with deeper structural reforms, senior advocates have already shown they are prepared. They have shown they are ready to respond. And tonight, for the first time in this benefit cycle, every senior in America has the information they need to act. The mailbox is quiet, the statements have arrived, and when those numbers don't match expectations, it means it is time to move. It means it is time to call your SHIP counselor at 1-800-MEDICARE. It means it is time to review your plan, verify your coverage, and protect every dollar you have earned. Because tonight, every senior watching this learned something they should carry forward. Your benefits are not automatic. They require your attention. Your coverage is not guaranteed to be optimal. It requires your review. And your voice in Washington is not optional. It is the only thing standing between you and decisions made without you. This story is far from over. But tonight, one thing is clear. You have more power than you have been told. You have more resources than you have been shown. And you have more time to act than you may realize, but not unlimited time. And we will be here watching every detail as the next phase of this critical story unfolds.